Families often want to make the intervention about mental health or the drug of choice. The drug of choice is irrelevant in the grand scheme of things. It is absolutely relevant by way of strategy. Intervening on an alcoholic or an opioid user is vastly different than intervening on somebody who's using crack cocaine or methamphetamines due to the volatility in the mind. So when we're intervening, we always factor in drug of choice, but by way of recovery, it really isn't that much of a factor. When people go to treatment, they're not separated by drug of choice. It isn't heroin addicts over here, cocaine users over here, meth over here, alcoholics over here. Everybody's behaviors, for the most part, are similar in the way that they think. Resentful, selfish, blame-throwing, anger, fear, what have you. So the drug of choice is relevant for us. It's really irrelevant for you. And for example, if a mom calls me about her daughter and she says to me, she's on fentanyl, she's on fentanyl, she's on fentanyl, and we work together for 3 days scheduling this intervention, and all we're talking about is the behaviors and the destruction, and we find out later she hasn't used fentanyl a day in her life and she's been smoking crack, does it change anything about the conversations we've had? And the answer is absolutely not. Addiction is driven by behaviors. And there's a deeper science that we don't have to get into of why certain people gravitate towards certain drugs of choice. You know, why people go to meth, why people go to opioids, why people go to alcohol. There's a whole science behind that. But for the purposes of recovery and your intervention, it's irrelevant. But drug of choice also greatly can affect what you believe is a primary mental health. I can't remember the last time a family called us and didn't want to try to convince us that their loved one had a mental health issue and that the addiction was secondary, especially with stimulant users. I've said this in many videos. You'll read it all across my website, and this is textbook clinical verbiage. It's not made up. A clinician has to assume that the behaviors are a direct result of the drug or alcohol use when alcohol and drug use is present, even on minimal levels, because alcohol and drugs can exacerbate mental health symptoms. You can have the most mildest case of bipolar, and drugs will amplify that. You could take a bipolar 1 disorder to a bipolar 2 with methamphetamine use. You can have people who think they're schizophrenic. That's a big one with meth users. Families think their loved one's schizophrenic. Drug addiction does not cause schizophrenia. So most of, I should almost say all, of our methamphetamine users that families tell us are schizophrenic, 6 weeks into treatment, there's no hearing voices. There's zero symptoms of it. So drug of choice is relevant for us. It's not relevant for you. Although, again, certain risk, fentanyl use brings overdose, methamphetamine use brings psychosis. So there's things like that, but in the grand scheme of things, it doesn't. But always remember, whether it's mental health or addiction, we have to get them to treatment so that we can determine what's driving which bus. And you can't make the diagnosis for them, and they're certainly in no position to make the diagnosis themselves.